Namaste friends, this is Dr. Sameer Nandan, general physician and an expert in diabetes. What do we do when we suffer from a headache or cold or fever or aches in the body? We go to the medical shop, ask the shopkeeper the tablet of our choice or his choice. This may not be dangerous 9 in 10. However, sometimes we are likely to suffer from severe side effects of the medicines that we take. In today's video, I am going to tell you about 5 common medicines that we take over the counter, the common side effects of those medicines, the safe dosage, and about who should not take those medicines. Number 1, paracetamol. Number 2, painkillers. Number 3, cold medicines. Number 4, gastric medicines. And number 5, sleeping pills. Let us first discuss about paracetamol. Paracetamol has multiple applications. Number 1, fever. Number 2, headache. Number 3, aches in the body. What is the ideal dose for an adult? Typically, a person can take about 500 milligrams of paracetamol every 6 to 8 hours in a day. If at all there is a fever, temperature above 99 or 100 degrees Fahrenheit, one may take paracetamol for a day or 2. It is not advisable to keep on taking paracetamol indefinitely without consulting a doctor, because these days we are getting to see dangerous fevers such as COVID. Many people think paracetamol cures the fever. It is not true. Paracetamol only suppresses the fever. After one takes paracetamol, he may be disease-free or fever-free for a period of about 6 to 8 hours. But after that, the person is likely to get the fever back because the condition inside remains as such. Therefore, along with paracetamol, the root cause of the fever should be identified and treated appropriately. These days, many people take 650 milligrams of paracetamol, which is not necessary. 500 milligrams is good enough. So, for conditions such as fever, headache, or mild body aches, one may safely try paracetamol in the dosage of 500 milligrams at the most 3 times in a day. What are the side effects of paracetamol? Liver disease or liver failure. Therefore, it is important to state that people who are suffering from any form of liver disease, for example, elevated liver enzymes, hepatitis, cirrhosis, jaundice, a word of caution is required. They should not take paracetamol except under medical supervision. The maximum dose of paracetamol one may safely try at home is about 1500 milligrams divided as 2 or 3 doses. Now let us move on to the second category, painkillers, also called the analgesics or anti-inflammatory drugs. The popular drugs in this category are DICLOFENAC, Aceclofenac, ibuprofen and naproxen. There are many more, but these are very common. What is the dosage of these drugs that can be safely taken? For example, DICLOFENAC can be taken as 50 milligrams tablet once a day or at the most twice a day. Aceclofenac 100 mg can be taken once a day or in rare circumstances twice a day. Ibuprofen is available as 400 milligrams tablet, which can be taken once or twice or maximum thrice a day. One may venture to try these medicines for a duration of a day or 2, generally not beyond 3 days, because the underlying condition should be identified first of all. If we just suppress the pain without identifying the root cause, it can prove to be disastrous. And it is also important to know that the painkillers are not useful for stomach-related pain or the acidity pain. These drugs actually increase the stomach pain. Now, let us understand about the various side effects of painkillers. The commonest is increased stomach acidity or the gastritis. It may lead to gastric ulcer also over a period of time. Some people suffer from a hole in the stomach, which is called the gastric perforation if they consume painkillers over long duration. Therefore, anyone who is already on gastric medicine better avoid painkillers. The second and even more dangerous complication is the kidney failure, also called renal failure. People who have kidney disease and whose creatinine is more than 1.2 or 1.3, they should not take any of these painkillers except under strict medical supervision, because we have seen cases where even a single dose of painkillers damaged the whole of kidney. It also happens that the doctors prescribe painkillers for about a week or 2, but the patients tend to abuse them over longer durations, say like for a month or more. This definitely should not be done. After painkillers, the next thing we have to discuss about is the gastric medicines. The commonest among those are pantoprazole, omeprazole, rabeprazole and esomeprazole. Is it safe to consume these medicines without medical supervision? No, absolutely not. These drugs also have several side effects. The common side effects of these gastric medicines are diarrhea, constipation, increased gas in the stomach or flatulence, chest pain, increased risk of getting infections. Apart from these, some long-term complications such as weakening of bones can also occur. So never take these gastric medicines except under medical supervision. For acute conditions like acute gastroenteritis or acute gastritis or immediate increase in gastric acidity, one may safely try these gastric medicines for a duration of 3 to 7 days at the most. For example, omeprazole or rabeprazole in the dosage of 20 milligrams taken on empty stomach in the morning once a day or at the most twice a day for a period of 3 to 7 days is alright. Or pantoprazole as a 20 milligrams or a 40 milligrams tablet taken once a day or twice a day is also alright for a duration of 3 to 7 days only. If you happen to require these medicines beyond that duration, definitely consult your doctor rather than self-medicate. The fourth category I am going to discuss today is about the medicines for cold. These are the medicines also useful in allergies. The common examples are cetirizine, levocetirizine, loratadine, desloratadine, fexofenadine. In the olden days, something called chlorpheniramine was very popular. When are these useful? If someone has a cold or cough or itching or rashes on skin, these medicines may be consumed for a duration of 3 to 7 days. For example, cetirizine 10 milligrams once a day, or loratadine 10 milligrams once a day, or levocetirizine 5 milligrams once a day. Mind you, these medicines should never be taken beyond once a day. Now, let me tell you the different complications of these medicines. Number 1, drowsiness. People suffered road accidents the next day following cetirizine intake. So be careful the next day after you take cetirizine. Apart from drowsiness, certain other side effects include dryness in mouth. Despite drinking lots of water, the mouth will always feel dry. The other side effect is constipation. And also there is a dangerous side effect by name QT prolongation on ECG. You may have guessed it rightly. Yes, that affects the heart. So these medicines taken indiscriminately over longer durations can lead to heart disease. The fifth and the last category I am going to explain today is about the sleeping pills, also known as benzodiazepines or anxiolytics or sedatives or hypnotics. The famous examples in this class are alprazolam, diazepam, clonazepam, clobazam, zolpidem. Now let us see who can take these sleeping pills. Well, honestly, no one. No one is supposed to take sleeping pills. Why? Because these drugs are few of the most dangerous medicines ever invented by the mankind. Why is it so? Because these medicines have potential to induce 100 or 150 different side effects. Let me explain to you some common side effects. Number 1, sleeplessness. Yes, you heard it right. The medicines which you are consuming to induce sleep also give you sleeplessness. This is the reason they are addictive. You may be taking 0.5 milligrams for a certain duration. After a month or so, you will feel like taking more than that. So you keep on escalating the dose and you will feel that even increasing doses do not give you the desired result. And rather, you will be prone for many complications. So, sleeplessness is one of the side effects. Number 2, memory loss. You tend to be very forgetful. Number 3, irritability. You get anger so easily. Number 4, depression, negative thinking, suicidal tendencies and depression. The next one is instability or vertigo. You may be prone for dizziness. Another side effect is the inability to do fine tasks. For example, writing, drawing, painting. Few other side effects include constipation or increased acidity. Therefore, friends, it is always advisable not to go for these sleeping pills. Then how do you get your sleep? I have made a separate video. I made it in Telugu of course, but English subtitles are available for you. I am putting the video link in my description below. Please go through that video and follow those tips to get sleep, but never opt for sleeping pills. Never ask your doctor to prescribe you sleeping pills, and if at all your doctor happens to write you sleeping pills, you request him or her to not give them. You discuss alternatives with them. Therefore, friends, today you learned about 5 common medicines available over the counter in India. Those sleeping pills are not really over the counter drugs, but still in India, many people can easily get those pills over the counter. I explained to you who can take those medicines, in what dosage, for how much duration, and who cannot take those medicines, and also about the common side effects they pose. Stay tuned to my channel. As a responsible doctor, I am going to tell you a lot more about very different health topics. So keep sharing my videos with your kith and kin. Stay safe, stay healthy, and subscribe to my channel. Thank you so much.